have used social media? Okay. I'm sure in your time on social media, you guys have probably seen social media wars, right? Or topics that cause a lot of debate. Okay. Well, one of these topics that I've seen a lot lately is that of breastfeeding versus bottle feeding. But really, is one better than the other? The answer is nope. While many organizations do promote breastfeeding, such as the American Academy of Pediatrics, the American Academy of Family Physicians, and the American College of Nurse Midwives, these organizations also state that in the end, the decision to breastfeed or bottle feed should be made by the family with their specific needs and circumstances in mind. So, how do we make such an important decision? When making the decision between breastfeeding and bottle feeding, a family should consider 3 important issues: health, accessibility, and financial impact. Breast milk has advantages for health because it includes many of the nutrients that a newborn needs to grow. These nutrients change as the baby ages as well. For example, when a newborn is born, the milk tends to be thicker, and as a baby ages, the milk thins up so it includes fewer and fewer nutrients. The breast milk also includes natural antibodies that move from the mother to the baby in the breast milk. Not only does this milk have advantages for the baby, but it also affects the mother. According to a study published by the Office of the Surgeon General, mothers who have breastfed at some point have a reduced risk of breast cancer. The risk of ovarian cancer is also decreased by 27%. There's no conclusive findings on this yet, but it's also been suggested that postpartum depression might be decreased by breastfeeding at some point or another. While there are many benefits to breastfeeding, there are also some downsides to consider. Not all mothers can or should breastfeed. There are 3 reasons a mother might be deterred from breastfeeding. The first would be issues with latching or production. Sometimes an infant just isn't able to latch onto the breast, or a mother isn't able to produce the amounts of milk that a baby might need. The second reason would be mothers who have illnesses that require treatment, such as medications, radiation treatment, or they have something such as a transmittable disease that might be passed from the mother to the baby. The last reason would be some babies suffer from allergies to some things in the breast milk or breast milk as a whole. For example, I know a baby, we call him baby Jonathan, that when he was born, he suffered many issues such as skin irritation, tummy aches, and other things, and he would just cry, and his skin was sore, and they couldn't figure out what was wrong. After a lot of tests, they found that he was simply allergic to many of the things that his mother was eating, such as he was celiac, he was allergic to fruits, he was allergic to milk, and he was allergic to tons of other things that he was just getting in the breast milk. While many people are quick to consider the health benefits of breastfeeding, they often forget those provided by formula. One benefit of formula is that you can choose the type of formula you use. If a child needs more of certain nutrients, you can pick a formula that has those nutrients, such as baby Jonathan. When his parents found out that he was allergic to many of those things, rather than have mom change her entire diet and skip out on all those foods, it was easier to buy him a specialized formula that he was able to digest and process without causing him all those issues. Another reason is that some mothers suffer from extreme pain from breastfeeding. As with breastfeeding, formula feeding does have some negatives though. Babies who are exclusively formula fed are more likely to suffer from common childhood illnesses such as ear infections and diarrhea. They're also more likely to suffer from more serious diseases such as leukemia, lower respiratory infections, asthma, type 2 diabetes, and childhood obesity. It was also found that babies who were exclusively formula fed were at a 56% higher chance of suffering from sudden infant death syndrome. The next issue to discuss is accessibility. One bonus of breastfeeding is that it requires no preparation. Mom needs only be accessible. If she can come to the baby can latch on, and he's ready to feed. Formula, however, does require preparation. It needs to be measured, warmed, and mixed. One bonus to formula feeding is that if mom's not accessible, anyone is able to feed the newborn. This means that mom, dad, grandma, grandpa, anybody is able to bond with the baby over feeding times. That's the downside to breastfeeding. If mom isn't accessible, she has to find the time to pump, store that pump milk, and warm it up for the baby to eat at a later date. And if breastfeeding, she's the only one who is able to do that. Now that we've discussed the health and accessibility, the last matter we need to discuss is the financial impacts that these feedings will have on a family. According to the American Pregnancy Association, in an article that compares the facts of breastfeeding and formula feeding, it states that breast milk is free, but formula costs between $54 and $98 a month, depending on the brand. This would be somewhere between $648 and $1,176 in the first year. However, it seems that breastfeeding might have more supplies. The supplies needed for formula feeding include the formula, bottles, nipples, bottle warmer, a cooler bag, etc. While the supplies used for breastfeeding, while generally optional, are as follows: nursing pads, nursing bras, a boppy pillow, a breast pump, storage bags, a cooler bag, ointments, prenatal vitamins, bottles, nipples, bottle warmer, feeding shawl, etc. Another important aspect of financial impact to consider is not only what you'll be spending, but what you'll be making. In a study done by researchers Phyllis Rippey-Young of Acadia University and Mary Noonan of the University of Iowa, it was found that after childbirth, short-duration breastfeeders, those who stopped before the baby was 6 months of age, and formula feeders experienced similar earning penalties. By contrast, women who breastfed for longer durations experienced a much steeper decline in earned income over the first 5 years of their children's lives. This might be because mothers who breastfeed tend to stay out of the workforce longer, and those who do return tend to take fewer hours. To recap, when a parent is making a decision between breastfeeding and formula feeding, they should consider all three of these issues: health, accessibility, and cost, to decide which method is best for their family. And we, as onlookers or as parents ourselves, should remember that not all mother and baby are the same, and they need to make their decision based on what's best for them. So the next time you comment on that social media war, just remember, be unbiased, be factual, and most of all, be supportive.